drunk man is helped into the emergency department as another ambulance pulls up. The waiting room looks like someone has just turned up the lights at a late night club. The resus area, where we look after the sickest patients, is full. 5 patients, more stable than when they arrived, each have a plan, but we've got no beds in the hospital, nowhere to move these sick patients to. The site management team are on the case and they'll clear beds in the next hour. But it'll be a long night for these patients and for their relatives. The waiting room is full. It's just after 1 a.m. on Saturday night in central London. The emergency department team are on night 2 of 7, and we're 2 team members down. The priority phone rings. It's the London Ambulance Service. 400 to 600 people have taken over a derelict building for a rave. The building is structurally unsound and part of it has collapsed. The Met Police and the fire service are on scene. They're concerned that the entire building will fall and we need to prepare for mass casualties. The NHS is an incredible organisation, and within that, I'd suggest that the emergency department is one of the most incredible areas. We deal with every medical condition from ingrowing toenails to gunshot wounds. We never close our doors. We're the face of the hospital, and we work as a team. And as we'll see, we work as a series of dynamic, high-functioning teams that form and disperse over a shift. But our job is this. It's to deal with what comes through the door, to deliver the best possible service with the team and resources that we have, to measure how well we did that, and to improve. And this description could equally apply to retail. In fact, I hope, as we'll see, there are many parallels between a retail store and an emergency department. My name is Chris McCullough, and I'm the CEO at RotaGeek. At RotaGeek, we deliver data-optimized staff scheduling for retailers, and I'm going to tell you no more about what we do. If you want to know more about RotaGeek, you can reach out to us either through the Future Stores website or online. Prior to joining RotaGeek, I worked as a doctor for 16 years, and the last 8 of those were in emergency medicine. Emergency medicine, A&E, is concerned with delivering exceptional care in the face of adversity and uncertainty. And my proposition is this, that many of the principles that emergency medicine teams use to deliver medical care in high pressure situations can be applied to retail teams responding to COVID. So let's return to our major incident call. As you remember, it's 1 a.m. in a full emergency department, and we've received an alert to receive a large number of casualties. Our first response is to declare a major incident. We label it. We're entering a phase in which we're going to work in a different way, and we need to communicate that to our team, to our patients, and to the organization. We assign new roles to staff. Although staff will have been trained for these, they'll be anxiety provoking. They may not have done these live. We establish communication structures and responsibility for the communication. How will teams get updates and what information do we need back centrally? Areas in the department will change function. The waiting room is currently full. We will send everybody home, and that will be used as a triage area for arriving casualties. And we need to ensure that the whole system responds in a coordinated fashion. If we run out of bed linen, we can't deliver effective medical care. And even at this stage, we plan for recovery. Multiple trauma casualties arriving at a hospital will disrupt the performance of that hospital for days, and that will span several shifts of staff. It's important that we plan for that now. And all of these responses are taken from the training manual used by medics, the Major Incident Management and Support Manual, MIMS. The definition of a major incident is this: when the location, number, severity, or type of casualty or event requires extraordinary resource. And this feels like a pretty good description of the situation faced by retailers as the pandemic hit. And looking back, retailers as a whole responded in a way much as an emergency department would have done to a major incident. So they declared it as a major incident. They labeled it. They made a number of statements, announcements, declarations to notify investors, staff, customers that there was going to be a fundamental shift in the way that stores and retail performed. As part of this, there was a shift for many retailers to preserve their cash position, increasing access to capital and reducing cost. Ocado ran a new share issue, raising 0.6 billion. Dixon's Carphone Warehouse increased their debt facility by nearly 0.3 billion. And retailers looked to decrease costs through rent reduction. Superdrug requested 25% rent reductions off their landlords. There were CVAs and pre-pack sales, an example being M&Co was sold back to its original owners. And we saw retail staff furloughed and many of those made redundant. And these were organizations who were putting themselves in a position to cope with this uncertain future. Key roles were assigned to staff. Retail members across the seniority spectrum have taken on additional roles and responsibilities, driven broadly by two things. One is a sudden increase in the amount of work or the type of work coming in. Secondarily, by a reduction of the rest of the team through furloughing or redundancies, and that additional slack needed to be picked up. We also saw businesses redeploy staff to areas of need. John Lewis asked 400 colleagues to assist Waitrose during the early stages of the response. Retailers established communication, connectivity with two groups of people, their staff and their customers. For staff, head office teams were working remotely. Store teams still remained on the front line in many cases, and furloughed colleagues needed support. For head office teams, there was a move to video conferencing, and you pick your service of choice. Pets at Home started a buddy system to check in on colleagues. They had cross-team buddies, and trying to fill in the gap that we lost as we moved to remote teams, and we implemented a similar system at RotaGeek. Store teams had the challenge of not being able to hold team meetings, but working in a more uncertain environment where communication became more critical. So communication apps, which allow two-way communication from head office down and back up from the front line, became a key source of information. And furloughed staff, it's so important to keep those furloughed staff members connected and supported despite everything unfolding in the world. And with customers, retail communicated in many established ways. So through the media, Superdrug issued a message to its customers through the media. There was a joint statement from UK supermarket chains coordinated by the British Retail Consortium, looking to reassure customers at the time of panic buying. Social media has a place, but retailers also engaged their customers in new ways. Harrods set up virtual consultations for its clients. Areas of retail changed. There were changes in store, one-way systems, traffic lights on entry, queue management systems, which sometimes are human-based and sometimes are technology-based, like with our partner company, Qdini. In-store cafes were closed to manage social distancing. From an operational estate perspective, dark stores were used to manage online fulfillment. The product SKU was reduced to help manage the supply chain. Retail was also delivering in new areas within the pandemic, so pop-up stores in the NHS or Nightingale hospitals. And some retailers started new product lines. I bought my first set of masks from Gap, and Brewdog, classically making alcohol, pivoted into making alcohol gel. But perhaps some of the most creative areas were the partnerships of organizations. So Morrison's partnering with Amazon for delivery, Pret selling coffee beans through Amazon. Deliveroo is now a delivery partner for Majestic Wines, Aldi, Holland and Barrett and Pret. And eBay set up online stores for the provision of PPE for NHS staff. We also saw a whole system response, and perhaps the best example of this is how retailers looked after their suppliers. Primark extended support for its suppliers by placing 370 million of additional orders despite stores being closed. Marks & Spencer's paid suppliers for shipped orders, but those that hadn't been delivered. And although it might seem a long way off this week, it's really important to plan for the recovery. A recent survey showed that 28% of retailers are doing more to support the local communities, and 20% see local high streets as having an important role in the post-lockdown world. Pre-COVID, the balance of bricks and mortar stores to online was undergoing a transition and a shift, but we saw COVID accelerate that hugely. But as a new feature, we've seen a shift from city centres to suburbs and regions. And while the timing and shape of the recovery is uncertain, it's really important that we consider what that world is going to look like, particularly as we have retail teams facing into a a second wave and a second lockdown. So the reason for us discussing this is to add credence to my case that retailers can look to the NHS and emergency department for approaches to dealing with major shifts in workload and major shifts in uncertainty. Retailers are already responding in a similar way to the way the NHS would approach a major incident. But in health, we train for events like these. We hold major incident training. We practice responses in the event of a biological or nuclear attack. We train on the technical and human factors required to perform effectively in high pressure situations. Now, some of you may have examples of these in your organization, but I thought this was excellent. So 4 years ago, Dave Lewis, the boss of Tesco, ran a doomsday training scenario in which they shut their entire head office in Welwyn Garden City. And the quote at the bottom said, at the time, it was a bit ridiculous and extreme. And training is the key to normalize your team's response in an abnormal situation. And it's that which drives performance. And I wonder how many dealers will run these type of scenario training in the next 12 to 24 months. So what I plan to do is walk you through 4 principles that emergency medicine teams use, mainly around human factors that translate into retail. And I think they're particularly relevant as we face a huge increase in certainty, much more this week compared to last. But before we jump into those, this is one of my favorite quotes. It's a lyric from a song. It's called Everybody's Free by Baz Luhrmann. And if you haven't heard it, listen to it on Twitter or your favorite streaming service. It says, advice is a form of nostalgia and dispensing it is a way of fishing the past from the disposal, wiping it off, painting over the ugly parts and recycling it for more than it's worth. So what I'm going to do here is fish my medical past from the disposal, unashamedly wipe it off and paint over the ugly parts and recycle it with you for more than it's worth. So take the bits that are useful, ignore the bits that aren't, and challenge me in the Q&A or directly afterwards if there are things that you don't agree with. So back to our major incident. We're now going to focus on techniques used by a trauma team looking after a patient arriving in the emergency department. So we receive a call that we have our first inbound patient. It's a man in his mid-20s, found under rubble. He has a head injury, he's unconscious, he's got a crush injury to his chest and he's broken his right femur, so the bone in the top of his right leg. His arrival time, ETA, 3 minutes. So I'm going to talk you through what's going to happen in these next few moments. The care of this patient is going to be led by one person and delivered by a team of 5 to 12 people. And that one person that's going to lead and coordinate that is the trauma team leader. And in my mind, that trauma team leader role is analogous to a leader in retail facing into COVID. The trauma team leader at this stage is thinking about the known information. So we know who's coming in, we know their gender and their current state. We know some of the unknowns. We know that we don't know their past medical history. We don't know if they've been drinking or taking drugs. We don't know their prescribed medication or their allergies. And we're also aware that there are some unknown unknowns. There will be some unexpected findings. So at this stage, we need to keep our thinking broad with a plan to narrow it quickly, but not too quickly, as we'll see in the next principle. The trauma team is assembled, and it will comprise at least of an anaesthetist to look after the patient's airway, an emergency medicine doctor to rapidly examine the patient, a junior doctor to ensure that we have access for blood tests and to administer fluids and drugs, and 2 members of the nursing team to monitor the patient. The team leader briefs the team prior to the arrival of the patient. Each knows their role, and there is an initial plan of action based on what we already know. So as the patient arrives through the door with the ambulance service, several things are going to happen simultaneously. The crew will update the team if there have been any immediate change in the patient's status. The patient will be lifted from the ambulance trolley to the hospital trolley, and then the team will start work on their particular area. We'll secure the airway of the patient and attach monitoring. So we're gathering more data, stabilizing the patient and gathering more data. And then the team are quiet but continue to work as the ambulance crew give a verbal handover. So at this stage, the trauma team leader is coordinating the team, capturing information and checking that against the known case, and expecting new information that will modify the current plan of action. So This is the principle of making decision-making with incomplete information. We need to form a hypothesis, instigate a plan of action, but modify that as more data comes to light. So the team are calling out findings. We have monitoring leads attached, and you can see in the back of the photo, we've got a pulse of 68. The blue number is their oxygen saturations, 93, it's low. So we're starting to get more information and initial blood test back. The trauma team leader is the central source of that data accumulation and then coordinates the team. So after a rapid assessment, we have a man with a head injury and a low conscious level. So we're going to anesthetize him and look after his breathing. So we're going to instigate a management plan, and we're going to get a CT head. We're going to look for some more information. He has a crush injury to his chest. So we're going to look after his breathing, give him oxygen. So we've got an action plan. I'm going to get some more data. We're going to image his chest. And he has a fractured right leg. So we'll straighten that, awaiting theatre. We've sent off a range of blood tests, and we're going to speak with relatives to get more information on his past history. The trauma team leader talks this through and out loud to do two things. One is to keep the team aligned with the plan and the next steps, but to be open to suggestion and challenge. And I think in retail, and probably more so now with the changes this week, there are really likely to be unexpected scenarios that retail leaders will be faced with. And it's really important that you have the ability to rapidly assess that situation, knowing that you won't have all of the information. The world is much more uncertain. While you're assessing that, your team need to be able to function independently. That assessment might take 5 minutes, 10 minutes, an hour a day. But then you can formulate a hypothesis and implement a plan on the data that you have currently. But it will be important to get more data and to reassess that hypothesis and change that plan as more data becomes available. And share your thoughts with your team and ask for input. The next principle is one of oversight. The role of the leader here is to maintain an awareness of everything that's occurring with that patient and between the team, to capture and process information. In human factors, this is termed situational awareness. And it's one of the biggest risks to team performance, and therefore the outcome of the patient is loss of this awareness. And this awareness is lost when the team lead gets too involved in the detail. As soon as the leader touches the patient, they risk losing their oversight. And this is of critical importance. Elaine Bromley had 2 young children, and in 2007 attended hospital for sinus surgery. There were 3 senior doctors in the room, 2 anaesthetists, airway doctors, and 1 ear, nose, and throat surgeon, alongside 3 senior nurses. After being put to sleep, the anaesthetist couldn't insert the breathing tubes to secure Elaine's airway. The 3 senior doctors over the next few minutes all tried different things to gain control of her airway. They didn't communicate with each other, and they became focused on that one problem of securing her airway. They didn't notice that Elaine's oxygen levels were dropping. And this is a can't intubate, can't ventilate scenario, and it's a medical emergency. None of the 3 senior team recognized it, and none called it out. Junior members of the team, the nursing staff in the room, knew, and their concerns were not heard or acted upon. Elaine's oxygen levels dropped from 100% to 40%. The 3 doctors worked for 20 minutes to secure her airway. 20 minutes. Imagine holding your breath for 20 minutes. Once they did, Elaine had suffered brain injury, and due to her low oxygen level, she never recovered, and she died in hospital less than 2 weeks later. Elaine's husband, Martin, was a pilot, and he was trained in human factors and the importance of teamwork and communication. And over the next few years, Martin drove a fundamental shift in the way that doctors are trained in the NHS. And this is an example of the catastrophic consequences of not maintaining that oversight. Another is United Airlines Flight 173, which is en route from JFK in New York to Portland in Oregon in 1978. The landing gear deployed just in preparation for landing, but the light confirming this on the cockpit's dashboard didn't come on. The pilot aborted the landing, fearing that the gear was not safely deployed, and the plane entered a holding pattern while the 3 crew in the cockpit investigated the problem. All 3 of them investigated it, and they lost their situational awareness. No one was monitoring the fuel level, and the plane crashed 6 miles from the runway, killing 10 people and injuring 27. 3 highly trained professionals crashed an airworthy jet because they lost their situational awareness. So translating that to retail, that oversight will be really critically important in this uncertain period, and collecting the data that you will need to maintain that awareness and making sure your teams can function autonomously, and avoid getting hands-on in the detail. And if you need to, hand over that situational awareness to someone else. Lesson 3 is to flatten the hierarchy. The role of the leader in this situation is tough and the cognitive load is high. The safe mechanism here is to open up your thoughts and approach to the team. So narrate your thoughts. It keeps your team aligned, and it shows them the next steps and allows them to challenge. And you need to create this challenge culture. Without it, as we saw with Elaine, people won't speak up, and the reluctance to speak up is huge, even if the outcome is awful and completely apparent to those being silent. In 1997, Korean airline flight 801 crashed in Guam, killing 223 people. A contributory factor was the cockpit communication and the co-pilot who was afraid to question the much more senior pilot over the poor judgment. The co-pilot was aware of what was going to happen and didn't speak up. Flattening that hierarchy is cultural, and you can do that as an organization, and you can do that as an individual. So encourage challenge and ideas, but you can use technology. We work with a partner company called Yapster, who allow you to message down to the front line, and then information comes back from the front line centrally, and shortening that distance between decision making and the front line will be key in uncertain environments. Major incidents and even individual cases can have an impact on your team. People cope in a crisis, but it hits them in the downtime. And as trauma team leaders, we debrief after a case. We recognize the difficulty, and it's okay to be affected by the experience that you've been through. And this doesn't need to take lots of time, but it's the time that you take will allow your team to cope better and to re-engage quicker. And I need this team for the rest of the shift and tomorrow when they're back on duty. And in the same way, retail teams have just been through an incredibly challenging time earlier this year as we now face a second wave and a second lockdown. And I'm hearing stories of medical teams this week already weary as they face the prospect of another hard winter. And I imagine retail teams are feeling the same way. So again, you can create this culture of support as an individual or as an organization. So pets at home with their buddy system. And you can also use technology. So we have a partner company called Thrive that we use for our RotaGeek team to support the mental health of our team. And they work with a ton of big companies in the UK and beyond. And the one thing I'll tell you about RotaGeek is you can create work schedules that minimize fatigue and that increase flexibility that will be really important in this time of uncertainty. So we covered the retail response to the first wave of the pandemic and how that mirrors a major incident, and then looked at 3 principles of how emergency medical teams deliver care to emergency and trauma patients. So how we make decisions with incomplete information, maintaining that situational awareness, flattening the hierarchy, and then the support and compassion for your team. There's a saying that when you have a hammer, everything looks like a nail. All I have is a tendon hammer and everything looks like a knee. But I hope in some way that was useful to you as retail leaders as we face into a tough winter and a second lockdown. Really happy to take any of your questions either now or after the event directly, and my details are there if you want to get hold of me. Email is chris@rotageek.com, or you can find me on Twitter @ChrisMcCullough. Thank you.